Good afternoon, and thank you for joining me today as we talk about COVID-19 here in Erie County. Today we have 13 new cases to report and 1 new death as of late last evening, which brings us to a total of 1,912 cumulative positive cases since March. 122 cases are currently active. 1,736 cases have recovered, and 54 deaths have been our total deaths reported in the NEDS database. Of the cumulative cases in Erie County, 56% are female and 44% are male. Regarding race and ethnicity of our total cumulative cases, 66% are white residents, 17% are African American or Black residents, 8% Asian, 2% other, and 7% unknown. Regarding Hispanic origin, 6% are Hispanic of any race, 83% are non-Hispanic, and 12% are unknown. And the breakdown of the total cases by age in the past 7 days is 3% ages 0 to 4, 2% ages 5 to 9, 11% ages 10 to 18, 11% ages 19 to 24, 44% ages 25 to 49, 16% ages 50 to 64, and 12% ages 65 and older. And the cumulative ages since the beginning in March you can find at eriecountypa.gov. Study after study has shown us the importance of the effectiveness of wearing a mask when away from your home and with others. And we now have so many choices when it comes to what mask to wear. Many of us, in fact, are getting quite a collection of different masks. A few tips I'd like to bring out today. Avoid masks that are made from materials that make it too hard to breathe, such as vinyl. Avoid a mask with a vent or valve, as that mask can allow those virus particles to escape and possibly infect the others around you if you are a carrier. Your cloth mask should be made up of 2 or more layers of material to help protect you and those that you come in contact with. A mask with a nose wire can be effective if you wear glasses in terms of helping to eliminate the fogging effect. And it's important to save the N95 and the surgical masks for our healthcare workers. Lastly, one of the biggest issues that I observe is that masks are being worn by too many people that are not over their nose. So your mask must completely cover both your mouth and your nose. And there shouldn't be any gaps on the side of your mask either. So please go to eriecountypa.gov to find out more about masks and how to wear them and what types. And again, everyone wearing your mask is so important as we go forward, especially as we move inside in these wetter and colder months ahead. And now I'd like to invite Melissa Lyon, the Director of the Erie County Department of Health, to share an update from the Department of Health. Melissa?
Thank you, County Executive. It's always a pleasure to be here on Wednesdays. So there are a couple of topics that I want to go over. They will seem repeat to many people, but at the same time, hearing the message more than once begins to drive home the importance of the message and what we need to be doing as a community. So we know that all close contacts of a known positive are recommended to get a test. A close contact is someone within 6 feet of a known positive for 15 minutes or more, even if both people are wearing masks. We know, as you have explained, masks significantly lower the rate of transition from person to person, but this does not reduce the risk to 0. It's so important to self-isolate until test results are received. So if you are a known positive contact or a contact of a known positive, if you are required or asked to get a test, please remember it is so important to self-isolate until test results are received. Per the Center for Disease Control and Prevention, to self-isolate means to stay at home and stay separated from household contacts to the extent possible. Use a separate bathroom and a separate bedroom to the extent possible. We know it's not always ideal and not all households are set up that way, but do your very best. This will minimize the potential spread of the disease in the community by staying home, and it will minimize the spread of disease to household contacts if you have a positive test result. So the reason for testing close contacts is to quickly identify individuals who are asymptomatic, mildly symptomatic, or even pre-symptomatic. What that means is that the case investigation and contact tracing can occur more quickly when a person is identified prior to symptoms, which then decreases the risk for additional spread in the community. So if you can imagine, if you're asymptomatic, meaning that you'll never get symptoms, or mildly symptomatic, meaning maybe a slight headache or a sore throat or just malaise, you may not think that you have COVID-19, or as you're moving around prior to the symptoms onset. And that's when the spread of disease is very dangerous, because the individuals are not even really aware that they are sick and spreading this virus in the community. So that is the reason that we're sending all close contacts and recommending that all close contacts of a known positive get a test. We know the spread of virus can occur 2 days prior to the onset of symptoms. And in many cases, persons that are asymptomatic would never know that they are a carrier of the virus. And therefore, it's important that all known contacts get a test. However, the part that I know that many people are confused about, a negative test result does not, and I repeat, it does not release any known contact from the mandatory 14-day quarantine. We know that a positive test result can occur within the 14 days of exposure. Therefore, if someone tests negative, let's say on day 10, they are still in an incubation period for up to 4 more days. They could still become positive until day 14. So that test date is truly just a snapshot in time. On that day, when they were tested, they were negative. However, they could become positive up until day 14. And I am so sorry to report that a negative test result after being exposed to a known positive does not shorten the quarantine period. This has been confusing for many people, especially students and parents. But it's important, if you are a known contact to a positive, that you are compliant with the 14-day quarantine, regardless of the test result. As a second topic, I want to just stress the importance of self-isolating while you await test results. The average turnaround time was recently reported around 2 to 3 days. So regardless of the reason for requiring a test, it is critical to stay at home and stay separated from household contacts as much as possible while you await the test results. If people continue to go about their routine activities, such as going to work, socializing, attending sporting events, having dinner dates, shopping, etc., and then receive a positive test result, this can result in many people needing to quarantine, as well as a deep cleaning of places such as schools and daycare centers, churches, workplaces, social venues. And in extreme cases, this may result in the closure of schools, businesses, and workplaces for deep cleaning. This can be avoided by self-isolating for a few days while the test results are being processed. We have had a handful of cases recently that had not changed their day-to-day activities while they awaited test results. And that did result in 20 or more people as known contacts. And there were likely some unknown contacts, such as strangers. These have impacted schools and daycare facilities, workplaces, and many families. So please, you are urged, when you have awaiting test results, stay home. It's important that we keep doing the right thing, wear our masks, remain socially distanced 6 feet or greater, and practice good hygiene. These really are the only tools that we have to decrease the spread of COVID-19 disease in our community. I know it's tiring, and I know we're hitting the fatigue mark, or maybe many of us are past the fatigue mark, but these really are the only tools that we have. So lastly, I was asked to talk a little bit about Halloween, and if I still believe that Halloween can be observed safely. And I do stand behind my early statement that this can be celebrated safely if proper modifications are made to the activities. And the CDC ranks the risk of activities into certain levels, such as low-risk activities, moderate-risk activities, and high-risk activities. And if you can imagine, lower-risk activities would be celebrating within your household, maybe displaying items on your front porch, decorating your house or your living space, maybe doing a Halloween decoration tour throughout your neighborhood instead of collecting candy, or doing a scavenger hunt trick-or-treat style within your household. Moderate activities would be small groups outdoors in open air areas that are distanced 6 feet or greater, attending a party that is outdoors, open air, one-way walking in, walking through, and walking out, and then visiting pumpkin patches or orchard where people use hand sanitizer before and after touching pumpkins or picking apples. Some of the higher risk activities would be in-person trick-or-treating, where individuals are handed treats from neighbors. So if there is going to be trick-or-treat exchange, we recommend that that be a contactless exchange. So preparing ahead of time prepackaged treats that can be displayed either near the sidewalk or in the yard so that people can stay distant 6 feet or greater as they're collecting their treat. Also doing anything indoors such as haunted houses or crowded areas where people are screaming. So screaming is a high-risk event, as we know that that would project particulates from our mouths, even when we're wearing masks, further. So trying to decrease the number of screaming or scary activities that you participate in. So with that being said, I wish everyone the best of luck as they celebrate Halloween and they do it safely. If they make the appropriate modifications, have fun this holiday. Thank you, and I turn it back over to you, County Executive.
Thank you, Director Lyon. Always some great information. I want to announce two special programs that are happening now that we'd like people to participate in. The first is we opened up this morning the second round of applications for the Erie County CARES funding. These opened on our website, eriecountypa.gov, and that would be the Nonprofit Assistance Grant Programs, the Municipal Reimbursement Program, and the Personal Protection Equipment for Small Business Program. That's open to any business with 100 employees or less. And again, eriecountypa.gov has all the information on those programs. I also encourage everyone listening and viewing today to participate in an online survey we launched this week to determine the most effective COVID-19 messaging and media to reach underserved populations. The survey consists of 17 multiple choice and open-ended questions to collect information pertaining to a respondent's background, language preference, access to technology, and most used news service. We're especially interested in making contact with rural residents, refugees, those with special needs, and individuals with primary language that's not English. And you can find that survey at eriecountypa.gov. So now I'd like to turn to the media for questions, and today we'll start with Talk Erie. Joel, are you with us?
Yes, ma'am. Thanks for having me on. I do have a question, or a couple actually, for Melissa Lyon. Good afternoon, Melissa. Obviously, we had President Trump in yesterday. Lots of temperature checks. And could you go over how helpful these temperature checks are for finding potential COVID positive patients? And is there a percentage that that you operate out of with the health department as to just how helpful this whole temperature check thing is?
Yeah, thank you for the question. And so we know that temperature checks are an effective way of identifying persons that are ill. Now, we're never quite sure what's causing the temperature increase. It could be COVID-19. It could be a variety of other illnesses. However, when someone has a temperature, they are typically in their highest level of virus shed or their sickest portion of their illness, which is nearly when they're shedding a lot of virus. So they are effective for excluding persons that are ill, for sure. Now, That's not necessarily the easiest, earliest way of identifying COVID-19 because, as I just mentioned in my talking points, we know that virus shed, a contagious period, typically occurs 2 days prior to becoming symptomatic, as well as mild symptoms sometimes don't even trigger the individual to think that they're not feeling well because it just could be malaise, a slight headache, maybe a sore throat, a little bit of congestion. So they are very effective for excluding people that are currently actively ill, and that's a good thing. Thank you.
Okay, and so is there any kind of percentage of? I mean, is there any research that you're seeing in your sphere of how well this is, how effective this is?
Yeah, so I don't necessarily have a percentage for you on how effective those that have been screened as having a high temperature actually translate directly to a COVID-19 infection. What I can tell you, though, that this has been put out as best practice for workplaces, schools, events, and self-monitoring of temperatures, even a better self-practice. So if we're self-monitoring at home before we leave work, self-monitoring morning and afternoon, you begin to understand your own temperature and what it fluctuates. And then if the slightest of changes is a really good indicator to say, maybe today I feel okay, but my temperature's up slightly just because of my own monitoring. So myself, I am not monitoring daily at home. We monitor daily at the workplace. However, I have been trying to increase the amount of time that I take my daily temperature in the morning before I even leave my home. I just think that's a really good practice to get into. I hope that answers your question, Joel.
That's very helpful. Thank you.
Thank you, Joel. Jet TV.
Hi, County Executive. It's Samir. My question will just be for Melissa Lyon right now. But Melissa, so you just spoke about Halloween and saying that could be done safely. So in light of President Trump's rally, can those type of political events, are they quote unquote safe during the pandemic? Should we be attending these? Should we not?
Thanks, Samir. I'm going to answer it from the concept of any event that has a number of attendees that are significant. So that could be multiple hundred. That could be thousands. I'm actually going to bring up, while I answer this question, a piece of information that I thought was really helpful about considering whether you're attending events or hosting events. And so a large gathering of a number of people that may be in close quarters and may not have the ability to mask or are choosing not to mask would be a high-risk activity, okay? That's the best way to put it. And then everyone needs to understand their ability to be comfortable at the risk that they would be putting themselves at. However, so a few things that I thought were helpful was, what's the location of the gathering? So as you're making your decisions, whether you're planning to have an event or you're going to attend an event, where's the location? Is it indoors? Is it outdoors? Does it have poor ventilation? Does it have good ventilation? How long are you going to be there for? Are you going to be there for half an hour? Are you going to be there for 4 to 6 hours? Are you going to be sharing a meal? And is that meal plated up and you go sit down, or are you passing dishes amongst yourself? How many people are gathering? Is it 5 to 10? Is it 50 to 100? Are you 100 or more? Are you 1,000 or more? How far are people traveling from? Are they traveling from places that have a lot of community spread? Be very cautious of what kind of community spread is happening as people are attending. And then, of course, the behaviors. Are people masking? Are they able to stay 6 feet apart or greater? Is there adequate sanitizer or hand washing stations? So I think that as we're making these decisions and we're coming into the holidays and we know that we're going to have indoor events, really take into consideration, think it through, and know where you feel comfortable doing that. Large gatherings, in general, pose a much higher risk of virus transmission. I'll throw in something a little bit humorous, is we've been talking about what we want to do for Thanksgiving, and I have a very small space, and so I will be likely not hosting a Thanksgiving activity. However, I have a barn, and the barn is wide open. Both doors open, all the windows are open, and we thought, could we somehow get together and enjoy our time, short period, in the barn. I don't know what that looks like, but anyways, I'm just sharing what's going on in our planning. Thanks, Samir.
Well, thank you for that. And then just to follow up with the county executive Dahlkemper. So, what thoughts, reactions to the crowd size yesterday at the Trump rally? Of course, I believe it goes against Governor Tom Wolf's orders. I believe the Steelers are allowed 6,000 or so, just over that, for an entire stadium, let alone a small area at the Erie International Airport where thousands gathered.
Well, as Director Lyon said, large gatherings are not safe in terms of the guidelines for COVID-19. I was pleased to see in the pictures that I saw that many, many people, in fact, it looked like the vast majority of people, at least the ones I saw behind the president, all had masks on. And so that's good. That's very good to see people wearing masks. But I am concerned about the number of people. I'm concerned about where those people all came from, because just from listening to some interviews on TV and elsewhere, there was many people who came from outside of Erie County, other states, to our community to see the president. I'm also concerned about the conditions on the bus. I don't have any idea, were people wearing masks on the bus or not? How long were they on that bus? Were they divided by 6 feet or more or not? Because we know when you're in a close situation like that, you're indoors. At least while they were at the airport, they were on the tarmac and they were outside. So they were outside, they were mostly wearing masks. They were obviously not socially distanced from each other, and they were also together for many, many hours. So there's some concern, obviously, there. Thank you.
Thank you.
Erie Times News.
Yes, Kathy, it's David. And just to follow up on that, do your concerns, and this is either for you or for Melissa, do these concerns rise to the level that the state regulations were violated? What, if you can take me through this from an enforcement perspective, is there anything that might lead to a citation that happened at the rally yesterday?
So I'm going to let Melissa talk about that, but I will start by saying that we did send, as we do for any event, we did send correspondence saying these are the guidelines, and we ask that the guidelines be followed. So I will let Melissa speak to anything further on the enforcement side.
Yes, David, as we've spoken in the past, the ability to enforce or have good compliance, we're very limited. We did send communication, and I don't have hard numbers of how many people really attended. I would say that all of the information that we received was somewhat anecdotal or estimations. So the outdoor event, how I have interpreted the guidance from the governor's office is 7,500 people is the maximum. And so with that being said, there had been reports that they were near to 7,500. And so at this point, there won't be any citations that I'm aware of.
Okay. And as far as the bus transportation, is that something that the health department will be looking into at any other, in the next few days, or anything, other aspects of the rally in terms of compliance?
There won't be a formal follow-up on that. If we see cases related to it, I suspect that will be part of our investigation. If something comes out of that investigation that's concerning, would we bring it forward and discuss, is there some reason to do extra education, outreach, compliance, mitigation measures? We could do that. But that's going to take, up to 2 weeks to determine if there had been aggressive virus spread due to activities related to the event.
All right, thank you.
Thank you. Erie News Now.
Hi, it's Lisa Adams today. My question is for Melissa. She just sort of answered it there, but I did want you to amplify a little bit on if there is any community spread or spread into multiple communities from the rally. It will take you 2 weeks to identify that?
So if let's say exposure occurred at the event, it would take up to 2 weeks. That's the incubation period from time of exposure to the time of symptoms. They said 7 to day 10, we could see an uptick. As I've talked in the past, though, it's really difficult. So I think we had been talking about the marches. There have been some marches and gathering around Black Lives Matter, and we were asked then, will you see an uptick? And it is difficult to determine, even just through the case investigations, even as thorough as they are, all of the activities that that individual may have engaged in to find out where they had contracted the virus. It's not always clear cut. It takes multiple individuals reporting similar situations for us to say, oh, that is a suspicious, piece to these investigations. We're seeing some linkage, and then it would be opened as a cluster at that point, I believe, because this would be a one-day event. I think we'd categorize that as a cluster and not an outbreak. I hope that helps answer your question, Lisa.
Yes, I think it does. And I just to follow up, just today, some new guidance came out from the CDC about what is social distancing. We had heard like a solid 15 minutes within 6 feet of someone, but now the CDC today is saying it might be something that adds up to a total of 15 minutes, so shorter repeated contact with somebody over a 24-hour period. So what do you make of that new guidance, and what advice would you give to people here, say, in a household, in a workplace?
Yeah, so I'm not terribly surprised that they are modifying that definition. I have not seen it yet. We would call that a dose over time. And Dr. Nadworny and I had mentioned this on an earlier press conference that, dose over time is how much virus over a period of time adds up to then be enough virus to make someone ill. So it depends on how much virus is being spread, how much virus is being then inhaled, let's say, and then for how long of a period of time. And so we call it dose over time. It's a very scientific definition on how we determine that. And I'll be interested to see how that impacts, one, case investigations, as well as quarantine and isolation. But as of today, we won't be changing the current definition that we're using because we've not been instructed to do so. Thank you.
Thank you. We'll go back to Talk Erie. Joel.
Yes, another question for Melissa. Thank you. There's new terms that are coming up with the pandemic, and something I learned today is called a quarantine pod. Can you explain what a quarantine pod is, and what's the real best practice when you're mingling people from other families into your own family?
So I'm going to ask a question back to you. So when you read a definition of quarantine pod, can you give me a bit more detail of where, what the background, where were they using this? Universities? That might be helpful.
I think they're using it in reference to maybe children that are learning together, number one, or children that are playing. And in this regard, it was with Halloween, with a Halloween celebration, that you might have some kind of a protected pod. But I'm not sure how you can identify that according to current guidelines.
So, Joel, I would say for the Erie County Department of Health practice and from a public health perspective, when we're talking about quarantine, we really want individuals to quarantine as separately as possible, because if by chance, anytime during that quarantine, they become symptomatic or test positive, anyone that's in that quarantine pod with them would start their quarantine all over. So if you can imagine 2 or 3 people quarantining at once and someone becoming positive, like say day 10, then the other 2 have to start from day 0 after that person is no longer symptomatic. So I say this because it can add up to 28, multiple days, months sometimes, depending on how many people and how long they're ill for. So we don't recommend it. And so I would say that's not a best practice. I don't love to use the word speculate, but I can make an educated guess that the reason that they're doing some sort of quarantine pod is that, one, they may not have other options available to them, and two, it continues them to, like you said, educate or keep people moving in their activities. But it is not a best practice, and we will not likely be endorsing that practice here in Erie County. Thank you.
And they might be using the word quarantine when they really mean lockdown or shutdown. I mean, again, people are throwing terms back and forth, right? Your official designation of a quarantine is if there was a known illness in that circle, correct?
So quarantine would be they were a contact of a known positive or a high risk of becoming positive, correct?
Thank you.
Thank you, Joel.
You're welcome.
I have heard the word COVID pod, and I don't think it's an official term, but I have heard of groups of people. Actually, someone I know is a teacher, and some parents have created a pod of their families, and then they have a teacher come in and help to teach those children remotely. So they're trying to limit their exposure to other people. But that's, again, I don't think that's an official term, but I have heard that term being thrown out there. Okay, we're going to go to Jet TV. Samir.
Thank you. So I want to circle back around to crowd size. So obviously, if we do have this event, and let's just say that there isn't a quote-unquote spike, outbreak, or cluster of cases that are directly tied to the president's rally, do you think this could be a step towards the Commonwealth, I guess, allowing for more occupancy, bigger crowds, et cetera? Or is that just because this was a presidential rally?
I do not see the governor changing any of the guidelines in Pennsylvania due to what may or may not happen due to a presidential rally. 2 weeks from yesterday will be the election. All of these type of events should be over at that point, and so hopefully we won't see any great spike from this. But I do not believe that there'll be any changes simply because one event didn't produce a spike or did.
Got it. And then I do have a question for either you or Director Lyons you'd like to reach. So, of course, we see 25 to 49-year-olds, the biggest age group with contracted cases of the coronavirus. Why do you think that group, I guess, is so heavy with cases?
I'll let Director Lyon take a stab at that.
Yeah, so thanks, Samir. So, interesting, a piece of information that we just received today, Wednesday, on our weekly call with the Pennsylvania Department of Health, was that even statewide, we had seen a high number of individuals in the age group that you've mentioned, and a lot of that has to do with being back in university and also resuming some of their routine social activities. Even if they've done them safely, we know that, as I mentioned, even mask wearing and doing social distancing is not a zero risk. There is a risk no matter what we do. So that particular group sort of en masse came back to in-person learning and resuming some of their routine activities. Now, what the state has said today is that we are beginning to see an uptick of the older population, and that would make sense as the younger population is either visited parents or parents have visited them, or they're seeing grandparents. And so it's very interesting to watch the age group shift, and I think you'll see in the next couple of weeks our average age may shift as well. So the virus loves it when people get together and socialize. It's a social virus that spreads very easily when we're doing the activities that we really love and enjoy and need as humans. We need contact, and so no one's fault. It's just how it happens. I hope that's helpful.
It is. Thank you.
I know that many of the universities have actually recommended, and some are insisting, that their students do not go home, that they stay at the university setting until they break, and many of them are breaking at Thanksgiving for the rest of the year this year. And I think that's very good advice. As people move back and forth, you just increase the risk of the spread. And so if anyone's listening out there and your child's getting lonely or you want to see them, it's just a few more weeks, another month to Thanksgiving. So the best would be to let them stay at school and encourage them to stay at school just to reduce the risk of the spread of COVID-19 as they move from one town to another. And now we'll go back to David at Erie Times News.
Yes, Kathy, thanks. Melissa, we've seen an increase in cases over the last nearly about a month. We just started seeing a little bit of a rise in hospitalizations. Can we expect, and I know this is crystal ball time, but can we expect to see more hospitalizations in the coming weeks, especially based on what we're hearing about some other parts of the country? Is that a huge concern? And are local hospitals ready if there is a rise in really sick people that need hospitalized?
Yeah, I think there's always a concern, and as I was just indicating, that the state has said we're seeing a shift of the virus now moving into the older population, which they tend to have higher complications and comorbidities or more than one illness that put them at greater risk, which then puts them in the position to more likely to need hospitalization for recovery. And so as we're moving into the holiday season and indoors, I think there's concern all the way around from the healthcare providers, health system side, from a public health perspective. Do I think they're ready? I think we've had as much time as we could possibly be afforded to be ready for what lies ahead of us. But as you said, it's a crystal ball, and we won't know until we're actually there. I will take the moment to plug getting your influenza vaccination, getting your flu shot, so important this year. That is one of the most effective ways to prevent influenza illness, and with the co-circulation of the two viruses or multiple viruses that cause influenza, now's the time to get your influenza shot, so your vaccine. So please do so. Please do so.
And Melissa, to follow up on that, have you gotten any reports from Shar or from anyone else in the health department? Have we seen any flu cases yet in Erie County?
Shar has not reported to me any flu cases, and I would suspect that if we had our first, we would have known. So I don't have any confirmation that we have influenza yet.
Okay, thank you.
Thank you, David. Well, I got my flu shot last week. I will reiterate what Director Lyon said. Please go out and get your flu shot. They're available at every pharmacy in Erie County, I believe, and many businesses are also giving flu shots. If you've never had a flu shot before, this is the year to get that flu shot. And now we'll ask Lisa Adams, Erie News Now.
Yes, thank you. Another question for Director Lyon. You talked a little bit about what your own Thanksgiving plan might look like in the barn. But I'm wondering if you would have any recommendations for a safe way to do family gatherings if people were to, say, test before they got together or test and then quarantine.
Until a Thursday, you still have a number of days there where you could have become infected with COVID-19. So it would take a very incredible due diligence of socially isolating or self-quarantining for 14 days prior to the event. I think the piece of information is minimizing the number of contacts that you have prior to any gatherings. And if you are gathering, keeping those small in the largest locations that you can, as well ventilated as possible, and wearing your masks when you're able to, meaning not when you're eating and drinking. It's going to be tough. It's going to be very challenging. I also think that testing prior to an event is just going to be logistically difficult because testing is not just widely available for anyone that wants it per se without needing a doctor's orders. There is some available, but if there was a large desire for that, we would overwhelm the system fairly quickly. I hope that answers your question.
Yes, and then along that same line, I mean, with travel or people considering travel for gatherings, it looks like Pennsylvanians aren't welcome in New York State at this moment. At least we're on a list of almost all the states in the lower 48 are not welcome in New York State right now. So what do you make of that?
Yeah, I had heard that New York had increased the number of states that they were requiring not come into New York. I think across the nation, as we've seen, cases are increasing. And so as we have increased cases, that would indicate there's likely more community spread. And each governor has had to make their own decisions to protect their residents. And so I'm not here to say, right or wrong. I'm here to say that that's the decisions that are being made. But we are seeing increased cases across the country, Pennsylvania included. So again, it's time to double down and really do our due diligence to stay as safe as possible. So thanks, Lisa.
Yes, thank you.
I think it's important for those listening and viewing to know that the governor of New York has said Pennsylvania and New Jersey, although we're not on the list, he's encouraging that there not be travel that's not essential between those states. And we do have many people who live in New York and Ohio, for example, who come to work in Erie County and vice versa, people who live here and go to work in those states. So there is no restriction against you doing that. The encouragement from the governor of New York is that your travel to New York and their travel outside to Pennsylvania be limited to what's essential. And we'll go back for a final round of questions. Joel Erie, do you have any last question?
Just one quick one for you, County Executive. I'm doing my candidate profile interviews, and it keeps coming up that the state is sitting on $1.3 billion in CARES Act funding. Are you making Erie County's voice heard on what you think should be priorities that way to spend that money?
Well, certainly, we continue to get our CARES Act money out, and we are in the middle of doing that, and we're very grateful for that money. But in terms of specific uses of that money, I haven't been lobbying for anything specific, but there are all sorts of needs, and I'm sure the governor has a huge list in front of him that he will decide where that money goes.
Thanks.
Jet TV, Samir, do you have a final question?
Yep, just one question. I am going to circle back around to the rally. So as we notice, obviously, cases across the country in Erie County, across the Commonwealth, kind of seeing an uptick or start to rise once again. And last night, the president, I'm paraphrasing, said something about he doesn't know why the governor hasn't reopened. So from your standpoint as a county executive, as well as Director Lyons, do you think Erie County, let alone the Commonwealth, is ready to reopen and get back to places like other states, let's just say Florida, Texas?
I guess I would say, from my viewpoint, what we've done in Pennsylvania here has been working. And our numbers here in Erie County show that it's been working. And much of our county is open. Businesses can be open. Restaurants can be at 50%. They have to, of course, fill out their certification. But we are doing things, I think, in a way that's very safe and very effective in Pennsylvania. And what we need to do is we all need to do our part. Wear our masks 100% of the time when we're outside of our home. And we need to keep ourselves socially distanced and be very careful about the activities we get involved in so that we can get this virus, keep it under control so our kids can stay in school and our businesses can be open. Thank you. Quick question, Erie Times News. David, do you have a final question?
Yes, Kathy. On the flip side of that, has there been much talk with the state about clamping down in any way, shape, or form as cases go up? I know there's not a whole lot of talk about going back to a yellow phase or a red phase, but are there smaller steps that are being discussed if cases can't get under control across the state?
We haven't had any of those discussions at this point. Again, here in Erie County, I'd say our numbers are still in fairly good control. We had a little bit of a spike a week or so ago. They've come down a bit now. We've been in the low teens for a number of days. We're grateful for everyone's work to try to help us get there. And the cases can be tied back to more like clusters rather than community spread. And it's the clusters, and I think to Director Lyons' point early when she spoke, it's those clusters that we have to all try to avoid. And we can do that if we follow the guidance that's coming from the health department. When someone calls you and they are doing case investigation, when they're doing that contact tracing, please listen to what they're asking you to do and follow their direction. If we all do that, we will reduce those clusters that have been happening in Erie County. And finally, Lisa, Erie News Now, do you have a final question?
I do. I hope this isn't something you've addressed in a previous week. I haven't been on the call for a while, but a lot of people still plan to vote in person at their polling places, while many are dropping off or mailing in their ballots. So what guarantees can you give people who go to polling places that those places will be clean, sanitized, and that people will be safe if they have to stand in line there or wait to vote?
So Erie County Election Board is doing everything, working with the health department. Dr. Howard Nadworny has been consulting with them. Our physical facilities, in terms of providing them with the PPE, the personal protection equipment, sanitizer, mask, all of those things are being provided. The Pennsylvania State Department is also working very diligently to make sure that all the supplies are there and as needed. So I think that voting is going to be safe. If you cannot vote by mail, although I encourage people to vote by mail this year, if you cannot, you will be safe going to the polling place. Do not be afraid to go out and vote. Your vote counts, your vote matters, and I ask everyone to please consider voting on November 3rd if they haven't done it by mail before then. So thank you very much for the questions. A couple things I just want to finish up with. The COVID Alert PA app, as we're talking about self-monitoring every day, I get a little message saying, how are you feeling today? It makes me think about that. I reply to the app that I'm feeling well so far every day I have. And I want to talk, just finish up with our star players, and we're going to pretty much focus on Corey today. The Corey Memorial Hospital is spotless, and they have great COVID-19 protocol in place. Corey City Hall and City Council, they're taking temperatures at the door. They've moved their council meetings to the community center to allow for better spacing for council members and guests. The Corey Salvation Army requires masks of all their volunteers. Appointments are necessary, one appointment at a time during the day. And they've moved the food distribution to a non-contact drive-through model where food boxes are placed in the trunks of vehicles by masked volunteers. And last but not least is Corey Counseling. Again, masks required, taking temperatures at the door, separate entrances and exits. Speaking of Corey, I need to just end with Blue Zones and the work site. Sanders during this pandemic. They're doing a great job down there. And I want to thank all our businesses who, again, really do a lot to try to keep our community safe. Thank you for being a great partner on this. So remember to wear your mask whenever you're away from your home. Keep your distance from others 6 feet or more. Wash your hands frequently and stay home, again, if you are feeling sick at all. And as always, stay as close to home as you can. Please stay safe and always stay calm. Thank you.